avoid, the misinformation and backlash and the stigma and the prejudice that comes with that.
With more cases of monkeypox being reported in Canada as part of a global outbreak, the health messaging of the virus is coming under fire. In particular, a tweet from Alberta's Chief Medical Officer of Health, Dr. Dina Hinshaw, is being targeted, as she mentioned that the majority of cases are among men who have sex with men. There's some concern this will stigmatize that population.
Monkeypox transmission is not based on one's sexual orientation. It's really important that we are getting the harm reduction messages out to those communities that are disproportionately impacted because of their social networks. But I think it's really important that we're getting the facts out.
Hinshaw did mention it's not a sexually transmitted infection and everyone is at risk, presenting a challenge for doctors on how to appropriately present the message to reach those currently being disproportionately affected.
Just so that those individuals can be aware of their risk and not ignore something that might be important to diagnose. So what we really want to do is diagnose all cases and prevent transmission.
I do think to talk about targeted public health outreach, it's important to work with organizations that are within various communities to spread the message through social network.
And it is becoming reminiscent of how the HIV/AIDS epidemic was addressed decades ago, and there's caution that we need to avoid making the same mistakes again.
Reality is if everybody just simply thinks that this is a gay, issue, then they're not going to protect themselves and they're more likely then to become, infected. And that's another lesson that we learned.
I would, encourage people to treat people fairly and be compassionate and simply, take precautions currently to avoid transmission.
In Calgary, Tom Ross, City News.